One of the questions that we get around here at the American Association of Christian Counselors is, what does it take to be a good Christian counselor? That's a really good question, and sometimes it's kind of a dynamic answer. So right now, I am just going to go through one aspect of what it takes to be a good Christian counselor. First of all, you really have to have some good social skills. What do I mean by social skills? That means that you are going to be sitting across from somebody every day and talking to them about some things that are very, very difficult in their lives. Are you comfortable sitting there and listening to hard things? Are you comfortable leading that conversation? So that means that you're going to have to ask good questions, that you're going to have to listen really well, not just to what they're saying, but what they're doing, what they're acting like, how they're emoting, and maybe they're not even saying all of the stuff that they are thinking. So you need to really be very in tune with that person, be able to read people really, really well. Another thing that you have to have is really good communication. So most of the time we think of that as counselors as asking a whole bunch of questions, which at the beginning, yes, you're going to be asking a lot of questions because you don't know that person. You've got to get to know them really, really well to be able to help them. But as that assessment part of the session continues, and as you get into more of that treatment part, you start to speak less and less and less. And that's really, really important because you want that client to feel very, very comfortable speaking. You don't want to be bombarding them with a whole bunch of questions. So sometimes, even in certain sessions, you won't ask one question, or maybe you'll start with a question and then you're doing a lot more nonverbal communication. Okay? And listening and nodding your head and giving them the indication that you want to hear more. Sometimes you're saying, tell me more about that. Or you may be even reflecting back to them some of the things that they said. It sounds like you're saying this. Am I getting that correct? That way they are having you tell them what they are saying so that they know that their communication is being heard by you. Another one is you want to allow for that person to talk a lot. As clinicians, we actually don't do a lot of talking in session. Sometimes we do, but most of the time we don't. Sometimes if we're explaining something like maybe brain development or how communication is supposed to work, or maybe some other aspect about a certain technique that we're going to be using, that's when we would talk a lot more. But then as soon as that part is over, we allow the client to do a lot of talking. So you've got to be prepared that yes, you're going to be listening a lot and doing some of these reflective things, but you're not going to be doing a lot of talking. That also means you're not going to be doing a lot of advice giving. That's a hard one. I'm going to be honest. That one's the hardest one probably to think about, but we'll get to that one in another video. Another thing that's really important for you if you're wanting to have good, strong social skills with working with clients is that you got to be okay with emotion. Lots of emotion comes out in a session, and you have to be prepared and be okay with very strong emotions. There are times with clients that I have had clients be very, very angry. Then there are times when clients are extremely emotional, just crying and weeping, so much so that they can't even talk. Then there are times when I have a client completely shut down on me, won't say a word, won't tell me anything, won't do anything. At that point in time, that's when you as a clinician have to be very willing and open to either let that person sit in that silence or try to help them work through it. Another thing is very important is your nonverbal communication. As you've probably watched in this video, I've been doing a lot of moving around, moving my hands, making good eye contact, leaning in, leaning back, different things like that. This all shows good communication. It also shows that I'm very interested in what the person is saying. So, for example, if I have a client in front of me and they are telling me about something that's very sad, I want to show them with my face that I hear it, that I have sadness too. You want to do what we call matching the client. If somebody's very happy and talking to you about something excited, you want to be happy too. Show with your face that you're happy and enjoying what they're saying too. This is all nonverbal communication that's showing that you're with the client, that you're hearing them, that you're with them in what they're doing and what they're saying. Another really important one is showing empathy. If you have a client that's really going through something difficult, they need to see it in your entire body language that you're with them, that you're leaning in, you're hearing, you want to hear more about this. What is really going on here? How is that affecting you? And those are very important things that they can hear from you, not just from your mouth, but from your body language. And then, of course, super important is that eye contact. If I was a clinician and I wasn't making eye contact, if I was looking all over the place except for at you, do I look like I'm really in tune with what you're saying? No, not at all. So that's really important that you're making good eye contact throughout the entire thing. So as you see, good, strong social skills is one of the most vital things that you need to be a good Christian counselor. If you'd like to learn more, we are so excited to teach you here at the AACC. Thank you.